of rhinoplasty, you think first third, the middle third, and the lower third. Excuse me, hold on one second. This thing just turned on me. Here we go. There we go. So the upper third of the face should be 1/3 of the length, then the middle third, then the lower third. If any of these are off, it can also throw your nose off. And when you throw the nose off in the proportions, then you start getting into weird looking issues. So first of all, I ask, what is it that you'd like to do? What is your goal for the rhinoplasty? A lot of times people's goals are to reduce the width of their skin, of their nose, because they think it's wide. A lot of people who are African American, mestizo, which is another fine word for the Latin, for the lower Americas, noses can be wide. And when they're wide, people don't like it because when they smile, they have a wider nose. I tend to have a wider nose myself. So if anything, I would probably get my nose taken in on the sides and pulled in. Another thing people care about a lot is the tip of their nose. And a lot of people want the tip of their nose really refined, and that's called nasal tip or tip-plasty. We have Hema watching, Sandra watching, Stephanie Salinas. We have several people join us on Twitter, and a whole heck of a lot of people join us on Instagram. So it's awesome. And then we got my YouTube fans there. We've got a couple people watching on YouTube. Definitely our YouTube is becoming more popular. So if you guys want to keep watching these or want to watch them later in the comfort of your home, then you can go to our YouTube site, Dr. Jeneby Plastic Surgery, hit the subscribe button and the notify, and then you'll know when all these are at. Today we can do a free virtual consult, little housekeeping here. Free virtual consult today. I can do it right here on my iMac. So when you're ready, we can go into the consult room. If you don't know how to use it, you go to the doxy.me site. We're going to try to put it up on all of the sites that you can go in, and then I'll do a virtual consult with you today. I did several today in the office. A lot of people from Corpus Christi, some people from other parts of the state. So if you're looking for something like that, then that's great. Also tonight, if you, I think on Facebook you can share what you're watching. And if you share it tonight, you only get it once, though. This is per viewer. That will give you $25 Jeneby bucks that can only be used in the office. It's not a cash deal, but you can use it toward a surgery or something retail or something like that, as long as the retail's over $100. So we're back to rhinoplasty. A lot of people don't like how their nose looks on the lower part of their nose. So what we normally do is you can do a rhinoplasty where you just conquer the top of their nose, which is also called the dorsum, or you can just conquer the lower part. Sometimes to get the lower part to look good, you're going to have to do something to the upper part. I have a lot of people saying hello, so if I don't say hello quickly, I'll get back to you. The upper part is called the dorsum, and the middle part or the lower part's called the tip. Sometimes people have a dorsum and tip that are out of place, and a lot of people will come to me with a hump. So when they come to me with a hump, I really got to get a grasp of what's going to look good. A lot of times with a hump, you can camouflage that hump with a liquid rhinoplasty, or you can place liquid, sort of a filler right behind the hump without any other, interventions. If you want me to do the tip, a lot of times I can take a small incision here on what this is called the columella. Okay, this part, if you grab it right now, that's called the columella. I'm trying to wave at as many people as possible. The columella is right underneath, and we make an incision along the columella and then lift the nose up. I know that sounds a little interesting to you guys, but if you really want to know how rhinoplasties are done, then you can go to my YouTube. We have a section on rhinoplasty, right?
Yeah.
We've made the YouTube easy. You'll see mommy makeover, you'll see tummy tuck, you'll see rhinoplasty, you'll see liposuction. These are all been segregated into different areas. So we put up the $500 off rhinoplasty procedure if you text in your name, email, and phone number to 210-270-8595, 210-270-8595 right now. Text in. That's my housekeeping. We're going to put it up on all the sites here. Stephanie, the finance manager, is watching with me, and she is going to be typing as we talk. Anyway, back to what we talked about. So when you lift up the columella, you're going to be able to open the nose just like so, and then you can reshape the nose. When you reshape the nose, you can make it cuter, thinner, and you can also give it a little bit of a rise. A lot of people, when they smile, I have one. It's called a plunging tip. Watch. See, it plunges.
When are you doing consultations at what time?
Are you asking me this, or somebody asking me?
Someone asking me.
Oh, when are you doing the consultation? Because I want to interrupt. Oh, listen, Sally, we're going to put how you're going to get this virtual consult here in a few minutes.
I put it up.
Oh, you did? You already put doxy.me? So Sally, you can go to my website, Dr. Jeneby Plastic Surgery, go under the menu. Then you can see virtual consultations, and then you can go in the room. I won't be doing the consult until I'm actually done, but then I will look at you tonight, I promise. So stick with us, Sally, and then I'll look at your nose, and then we can, don't want to?
Because she doesn't want to interrupt you.
Oh, no, you're not interrupting, Sally. I'm just saying right after this, if you can just let me finish the, till about 8:15, then I'll wait for you in the room, the consult room. And we're going to put up again how to get to the consult room. You'll see it under Dr. Jeneby Finance Manager. You're welcome, Sally. Can I do the August special but do the payment plan still? Yes. If you put the $500 down now, it says Beauty Bonita. Just email us, Stephanie, looks like on Instagram. Can you put up how to get the special, the August special, which I will digress a little bit. The August special right now is 6 areas of liposuction for the 4-area price. So you get 6 areas of lipo for $49.99 instead of $69.99. So you get about $2,000 off. Stephanie, I think these young ladies on Instagram are the ones that are asking questions. One is,
yeah, I'll put it up.
Okay, she's gonna put it up for you right now. It's called the Only Bonita and Sally Malley. Okay. So the Only Bonita and Sally Malley, just wait a second, we're gonna put something up for you. So as the nose gets pulled up, I can see the inside, and then I can sort of shape the nose. And then on the dorsum of the nose, I can rasp it. A rasp is just a fancy word for a handheld device that actually can take pieces of the nose and just finely bring them down. The issue is when you take a piece of the nose, you've got to make sure you balance it by making sure that you don't cause any breathing difficulties. And a lot of times when I'm doing a big nose job or rhinoplasty, is I'll take the inside of the nose called the septum, where you can feel it right now, use it as spare parts and create what they call a spreader graft. Now the spreader graft holds the nose open when you inspire. If you can see here and here, if I pull real hard, you can see it collapse. But when I put something in there, they're like crutches and pushes it right out. And those are called spreader grafts. We have a lot of people joining us on Instagram. My buddy, Dr. Eric Williams, creeping on me. He's a urologist. I don't know why he's joining us. Dr. Alvarado, my buddy, Dr. Payne. Dr. A takes the pain away. If you need a good pain doctor, let me know. He is on Facebook right now. So after I put the spreader grafts in, I'll pull the nose back down. And then what we do is we can fracture the sides of the nose. And I know that sounds terrible, but what it does is thins out the nose and actually makes your eyeballs appear a little farther apart, which is interesting for what you think that the eyes should look like. And then we'll do some last minute contouring. I'll pull the nose in. What's going on?
I was able to post something already.
Oh, okay. So my producer's in the background. He's doing this, so naturally I'm going to ask him. So after we do that, so I'm going to take you through something. I'm going to walk you through some things that I've created for you on my Mac right here. And as you can see, this is what the nose looks like on the inside. I hope you guys can see it. I'm gonna try to touch it so you guys can get an accurate view. It may be a little bright. I hope it's not too bright for you guys. Tell me if it's too bright. Let me know. Does that look too bright?
Yeah, it's too bright.
Oh. Dang, I don't know how to take it down. Maybe you can come over here and make it less bright. There's a bright button. So once we get that going. Now, a lot of you guys are gonna want, like I said, a lot of you guys are gonna want the full Monty. Oh, how did you, okay. How about this brightness? Huh? Oh yeah, much better. How'd you do that?
There's a button right there at the top by escape.
All right, you got it. So here's the nose anatomy, okay? These are the nasal bones. Believe it or not, your nasal bones, when you break your nasal bone, okay, you're only breaking the top. And let's feel together here. Take your hands and go from the root of your nose, go all the way down, feel to the top, and then when you can start moving your nose like this, you've got the step off between the nasal bone and the cartilage. Then you've got the cartilage right there. Feel like a weatherman. Right there, guys. The cartilage right there, that right there is what I go to sometimes reshape things. And I put a spreader graft in between the septum and the cartilage. The septum is that, you can feel it. It's on the inside of your nose. All this stuff went dark, by the way. We're gonna see why all of it went dark. Or it's looking at me or something. So when you put the spreader grafts in between the septum like this, you're gonna get so that you can breathe better. A lot of people come to me for secondary rhinos because when they got their first rhinoplasty, they the area around the nose there. Oh, did you turn that thing off? That's why I'm not getting any light. Try that again. There we go, better. I was in the dark here. So I'll do the spreader grafts. Did you undo the light? You
Maybe
probably
we
did.
turned it on. We were too busy.
So the spreader grafts go in here, then you can breathe. So here we go again. It went, oh man, you know what it is? When you turn that on, this gets too bright, so maybe a little less. Yeah.
I'll pick it up higher.
Pick up a little higher, a little higher. There you go. Okay, so down here is what they call the lower lateral cartilages. These are the upper lateral. These are the lower lateral. These are what, that looks really good right there. These are right here what control how big the lower part of your nose is, okay? So you have bone, cartilage, cartilage, bone, cartilage, cartilage. When people break their nasal bone, they're only breaking the top part of their nose right up in here. The rest of this is all cartilage, okay? So this is your lower lateral. This is how you make a nose look cute, by resecting or taking off the top part of this lower lateral and putting it in a slightly different direction. Oh, Ayuno Juanez says it's really blurry. I don't see that's blurry, but maybe your connection is, or maybe. Yeah, I think your connection may be blurry, Aura. So that's really a rhinoplasty right there. So let's go to the next slide. 1 second. Okay. Again, here's kind of a cartoon view of it. You can see the lady's nose here with cartilage. This is a side view of that same cartilage, and you could see we're also putting up Credit Novo. If you guys need financing, please look up Credit Novo on the website. So you can see here, this is the nasal cartilage, the bone. This is the cartilage from the side view, and this is called the basal view, looking straight up like this. And you can see there's a little bit of an area where we can put cartilage in to make the nose a little bit more triangular. Like I would need probably a cartilage piece there, and then to make these a little cuter, then I would actually be cutting the top of this to make it like less boxy and the tip to be less boxy. This is a very nice animation or stop animation of this woman who had a dorsal tip. Somebody from YouTube just sent the question. So the top of the nose right here, when you have a dorsal hump, there's a couple of options. I can go in and just rasp that hump so that I can take the hump down, okay? Take the hump down right there. And when you take the hump down, you take rid of that dorsal protuberance right at the top there, which is mainly bone and a little bit of cartilage. So she has a little bit of a dorsal hump here. So now I'm going to show you some post-ops. These are my patients. They don't belong to anyone else. And here we go. So you can see here, this lady had a problem with her dorsal hump, her nose not being cute, and then you can see the after is on this side, before with a hump. The nose wasn't cute, and then how straight it is and how straight and narrow it is. Over time, these are on my website if you guys want to look at them. I personally like to do rhinoplasties. I think they're awesome, fun. They're very, very super technical. Again, we're going to show YouTube, Instagram, Twitter, and Facebook, all of these. So again, before and then after, you can see the nose cuter. It fits her face even better. There you go. There you go. And let's look at another one that I did. This one here again. So she had a, this is the before on this side. You can see she had a dorsal hump. The down part of the nose was not super cute, and a little bit of a dorsal hump. Sorry, on this side. I'm going backwards. Give me 1 second. It's hard to do it backwards and backwards. Pre-op right there, dorsal hump, not cute. Dorsal hump, not cute. See that? And then after, where I've taken the nose and made it completely straight. And then I've also rotated her nose upward, to give her more of a cute nose. Okay, here it is. Pre-op on this side, and then a rotation upward on that side. Pre-op on this side and rotation, and it actually fits her face so well after we've made her nose a little bit fancier. And of course, these are all 1 year post-ops. Beware of watching post-ops that are under 1 year, because it almost never works. So those are 2 out of the others. The rest are on my website. So preoperative from a rhinoplasty. 1, you got to let me know if you have any breathing difficulties, because if you have some breathing difficulties, then I have to send you to see an allergist. Remember, like me, I know I have allergies. If you're coming to my office and you're already heavy breathing or you're mouth breathing, then I need to send you an allergist to make sure to find out why you're mouth breathing. 90% of the time, it's because you have allergies that you don't even know about. Good evening from something Fei C on Twitter. Thank you for watching. After I get that going and I make sure that you didn't have any trauma as a kid, not only did you not have any trauma, but you'd have breathing difficulties as a kid. Did you play a lot of sports? Could you have fractured your septum or your nose? We don't know. I look inside your nose. When I look inside your nose, I'm going to see the condition of your septum, and I'm going to see, in general, the redness on the inside of the nose to see if you have chronic allergies, to see, like, if I go in there and start operating, am I going to get into some kind of bleeding, okay? So we are not, so that's basically what we're going to do here. What I'm going to do is set up the virtual consult so that we had a couple of people that want to go into the virtual consult room. And I think once I get in there, I'm going to take out my PowerPoint, and then we've got to get to the doxy.me, and sorry, excuse me, everyone, right there. So that when you guys want to come in and look, we will be able to, doxy.me, excuse me, guys. I'm sorry that this kind of went down on me, but you want to see the doxy.me website here? Oh, it's coming up. Okay. Why am I doing this? Because I know some of you guys want to eventually come in to the site. So Ashley, can you sign this in for me? The doxy.me. I'll give you the username and password. It's right here. You got to come here. You can't take that off. So Ashley's going to sign in for us. Wade Eccles is watching. Ash, your buddy. Jeneby at Yahoo, and this is the thing. Oh, this place would not be possible without my lovely wife Ashley, without my producer Joe John, here's a quick little view of Joe John. If you ever need the greatest producer in history, just kidding, at least in this 3-foot distance. Everybody said wave hi to Joe John. He's got the lighting down. There's Joe John right there. Come on over here. There you go.
The light is good.
The light is good. Wade says, hey, pals.
Oh, my pal.
Ashley says, what's up, Wade? Okay, so I'm going to look at your nose. I'm going to look inside your nose to see if there's any fractures, any dislocations, anything to that way. When I look up, I'll use a light, and that's why you come to me. You come to me for a full consult. So I'm happy to do that. Afterwards, we're going to go over exactly what you want because we have somebody, Stephanie, that says from Walker, how much is the first consultation? Well, Walker, we are doing virtual consults tonight, complimentary. To see me is a $75 consult fee. To see my coordinators, it is complimentary. If you want to just skip to the line, you can text us. That's right, free consult tonight, but you can text us right now, Walker5. She's going to show you how to get to the doxy.me website, which we're waiting on the first couple people to come in. Or you can text us and let us know that you want to have a consult. After we talk about your desires, most people tell me that their nose, the nose falls into several categories. That you know, the basic shapes of the nose are what people want. So they don't like that they have a dorsal hump. They don't like how their tip looks good, what their tip looks like, or they don't look like how wide their nasal base is. This is called the nasal base. And to reduce the nasal base, get the tip smaller, and to rotate the tip and to do a hump is about 90% of what everybody wants. Go figure. Afterwards, what can you expect? You could expect some swelling. We're also going to break the nose. And the reason we break the nose is when you do a dorsal hump, you can create what they call an open roof defect. An open roof defect means that this can groove. You can have this really nasty groove down the center line. If that happens, you have to break the sides, and then the sides will come in and close the open roof. Pretty neat. The problem with that is it gives you these, what they call raccoon eyes. And you've seen raccoon eyes in boxers. And it gives you this kind of this bluish discoloration, which lasts anywhere from 5 days to up to 2 to 3 weeks. Did you have something? So the raccoon eyes just stay underneath. We have, where are you located on Twitter? We are in San Antonio at 7272 Wurzbach. We're going to put that up for you right now. Stephanie will put up exactly where we're located. The raccoon eyes definitely take about five days to up to 2 to 3 weeks to go away. It depends on how you bruise. So if you tell me it takes you a long time for a bruise to go away, that's what's going to happen. Also, what you're going to see is several small stitches here. If you want to bring in the nose, you'll see some stitches on the inside. From John Shaken, what do you guys want to get their body ready for a six-pack? Just need a little help. Okay.
We got someone on YouTube.
So on John, oh, I didn't see it, it went away. John says about a six-pack. We do have a special for buy 6 areas. So text us your name, email, and phone number right now to 210-270-8595. Our finance manager, Stephanie, just put that on. A girl named Erica Saucy, I think, says, I want to do my nose. Excellent. You see right above you is how to get a hold of us, 210-270-8595. If you book it tonight, you put your deposit down, or if you come in tomorrow, you can get $500 off. It'd be easier just to book it tonight. And then that way, and I can also get you on the Doxy Me. So I'll be doing virtual consults when we're done here. If you don't know how to do it, we've put it up several times, but if not, you can go right to the website and then look up how to get on there.
Sandra Ramos says, hey guys.
Hey Sandra, do we take insurance? No, unfortunately, we do not take insurance for any procedures at this point. And Erica Soxy, oh, she said she's going to make an appointment. Excellent. Good news. What else? So the one thing I got to stress to you about rhinoplasty is that, oh, here we go. Sorry. Javi and Kim, Navarrete want to know how much for the down payment. It is a $500 down payment. John Chaikin, the number is right at the bottom here. We just put it up to schedule a free consult, or just look on this on the scrolling. 210-270-8595. My good girlfriend, buddy, Christy Garfield's watching. Known her since '04. Excellent, excellent. Thank you for watching. $500 gets you a down payment. Do I ever come to Golden EOS? Do I ever come to Los Angeles? No, but I do have a California license, so I may call my buddy Lisa Castellet if you really want me to come out to see you. But why don't you first do a virtual consult first? And the easiest way to do one is you go to the doxy.me website right here, and this is called a virtual room, okay? This is my virtual consult room. I will not put out who I'm watching, and we can see each other right through the cameras up there and your camera, and it is free tonight. Complimentary consults, free. So make sure you get up there. Make sure you get a consult tonight, because I'm going to be doing them as soon as I'm done. It looks like we're getting a lot of activity on Hurricane Ashley. Thank you. My producer, number 2. That's what she calls herself. Fresh like lemonade.
And green like guacamole.
Okay. I had my rhinoplasty done when I broke my nose on Twitter. Yes, I can understand that. Is there a question? Probably just a statement. We have a lot of where have you located? Yes, I've heard you on Billy Madison. Yes, I've been on the Billy Madison show. But it was just to fix the break. Yeah, sorry. Yes, so rhinoplasty and a septoplasty and fixing are kind of different. When I think of rhinoplasty fixed, so that a rhinoplasty in my mind means a cosmetic, means something cosmetic, although you can have reconstructive rhinoplasties. In my world, it's all cosmetic, and I can do rhinoplasties after things happen to you. Like you've had a sort of a septoplasty, or you've had something else happening. I had a guy came in, he had a rhinoplasty, and he jumped in his pool, all right? He jumped in his pool, and he hit the bottom of the pool and screwed up his original rhinoplasty. So that was more reconstruction. So I was able to take a rib and create a nice new straight nose for him.
So you hear like on the housewives and stuff, all
Yeah.
of them get surgeries because they say they have a deviated septum.
Okay.
What does that mean?
So a deviated septum means this part on the inside, if you take your finger and just try to push to the other side, you can't. That is called the septum. There you go. He's doing a nose picking maneuver, and that's it. It's right on the side. You can't go further. That's your septum. When it's deviated, it's off to one side. When it's off to one side, that's corrective septoplasty. Sometimes to get a corrective septoplasty, people that can then disguise a rhinoplasty. So we don't do that here because we don't take insurance. So Connie Overstreet Eccles, if I get a facelift, will it fix the bags under my eyes as well? That's a little bit different. The facelift really just adds to the face
That's my cosmo.
and neck. The eyes are separate, but I do them all at once. So I can do upper lid, upper lower lid, forehead, upper lower lid, face and neck. Tonight we are offering $500 off surgeries. If you go ahead and make your deposit, it's basically we're matching the $500 deposit tonight. So it's a good way to make it easy $500 by just putting your deposit tonight. If you text us, we'll show you how. My finance manager will text you a way to do that. So corrective septoplasty, like we talked about, is when I take this septum, maybe it's pulled off to the side, maybe it's a little bit warped. You take the septum out, you can put it back on called the vomer, and it'll put it back on. Now, a lot of people use a septum and then use parts for the rhinoplasty, which is the rest of it. I know it's a lot of weird terms. That's kind of why I'm doing this. It's a very difficult topic. We're trying to do it in under 30 minutes. We've actually been on 33 minutes. And I'm going to tell you, there was somebody here that wanted a consult. There was actually 2 people. So if you want to come in, I'll be doing consults starting about 8:10. And you just got to let me know. We're getting a lot of people coming on. We're also going to transcribe this for you, and we're going to put it on our YouTube, and then we're going to put it on the Q&A with Dr. J page. This is our 5th installment. The first one was Mommy Makeover. The second one was Tummy Tuck. The third one was Breast. The fourth one was, I can't remember the fourth one right now. Ears, otoplasty. And now today is rhinoplasty. Next week, we're going to talk about arms. You know, those arms when you wave them and you have a little bit of extra. You're waving arms, you have a little bit of extra. I'm doing a lot of those lately, I guess, because, you know, the summertime was here and you guys wanted to wear your tank tops. So we're doing a lot of arms lately. We're also doing a lot of medial thigh lifts and body lifts, which will be after arms. We'll go back to medial thigh lifts and body lifts after that. So bat wings, there you go. Connie Echo says bat wings. How much is usually a lipo 360 with a BBL? Okay, that's a really good topic. Lipo 360 with BBL is somewhere in the range between 9,000 and 12,000, depending on how many areas we lipo. If it's in this, 6 to 8 areas, we're in the 9,000. If it's like 10 or 12 areas, then it becomes more. But tonight only, $500 surgeries if you text us at 210-270-8595 with your full name, date of birth, and email. You have to do it right now during this or you don't get the $500 off.
What's the downtime with the rhinoplasty?
Good question. So rhinoplasty downtime. If you're just doing a tip, you really just have sort of bandages on for about a week. If I'm breaking the nose like a full rhino, or we're having to do a lot more, you're looking somewhere around 2 weeks at that point for that kind of stuff. So just let me know. Usually a rhinoplasty looks really good somewhere starting around 6 weeks to 3 months, but the final result is somewhere in the realm of, I would say 1 year. And some of the guys who do a lot of rhinoplasties even tell their patients somewhere in the realm of 2 years for a rhinoplasty.
When can you go back to
But, well, when can you go back to work? This is a big $1 million question. If you're not going to be in front of the camera, you don't care what you look like, you're okay with people asking what happened, I don't care, you go back to work the next week. It's usually people don't want to have the stigmata of surgery, so they want to go back like when they're done. Oh, I have to do some little housekeeping. We have another August special coming up for $7.99. That's under $10 unit. Get a microderm. We also have a vaginal tightening special for $199. You can get the vaginal tightening from our Intimilase, which is a very, very awesome machine, and people love the Intimilase. That's our spa specials, and the current plastic special is 6 areas of lipo for $49.99, which is roughly $2,000 off. Cool. Megan Rios says, can you do a tummy tuck makeover if there's scar tissue from a previous abuse? Interesting. Yes, we can. I do tummy tucks with women who have up to 5 to 7 C-sections, I've heard. I've seen them have other surgeries. I've done revision tummy tucks. I've done people with gallbladder scars. So we're not scared here. So yes, we can do anything you need to do. We need to get your name and number, and you can text it to 210-270-8595. I think it's the how to do it is rolling up just now. But back to rhinoplasty. When are you really going to see a result? You're going to see a really, really good result somewhere around 6 months to 1 year. Yes, it gets better. Yes, the swelling goes down. But you will have the stigmata of a rhinoplasty. You could have the bruising. The nose will stay sort of swollen for a while. We don't really have a good grasp on why the nose stays swollen that long. But we are putting up the numbers and everything you need to do. Lots of waves, lots of love from Instagram, lots of love from Twitter. Thank you all. I'll be waiting for you in the doxy.me area. we're going to get this transcribed. And if you missed today or you want something you just missed or you want to hear it again, this is also up on my YouTube. It's going to be put up live. We're going to add some other things to it, and we'll get it transcribed. So everybody tonight, please, if you want something, text right now, 210-270-8595 with your name, email, and phone number. We're not going to do anything to it. All we're going to do is we're going to hold it. Then we're going to get your deposit, and then that $500 goes off of surgeries for the rest of the time of August. And then if you're really, really nice to us, we'll extend it off for another couple of months so that you can get your kids back to school and you can do other things. But I appreciate you watching. Rhinoplasty is very difficult. And Megan Rios, good job. You texted us. We love it. Tonight, also, if you share this Facebook, unfortunately, per person, if you just shared it, then you'll receive $25 Jeneby credit to other things like any of the retail or other surgeries. So everybody text in right now, 210-270-8595 before I leave here. As this thing is ending, you've got a few more minutes to text. When you text in, you get $500 off any surgery, and especially in the month of August. But if you pay tonight or tomorrow, or you put your deposit down, we can extend that time for up to a couple of months. So that gets you time to get all your affairs in order, get your kids off to school, sort of bypass the heat, and then get your surgery. And I'm telling you right now, surgery beats anything that you can buy on your own. Why? Because every morning you can wake up to something that you like to see. Buying something stimulates the dopamine part of the brain just once. But a memory or looking at yourself in the mirror that you love more and more and more is much more healthy for you. It provides constant dopamine stimulation, and dopamine is what makes us feel better, along with oxytocin and other brain chemicals. That's for a whole nother topic. But anybody that's joining us tonight, text us right now, 210-270-8595, and I'll let you watch my big dog. No, just kidding. I'll give you $500 off your surgeries, but you have to pay this month at least the deposit, and we will take care of you. Stephanie will stay on for a little bit longer, and go to our Facebook site. Our Instagram is going to shut down here in a minute, but everybody who wants to put the $500 now, go to the 210-270-8595. There's only 2 genders. I'm not sure what that means. That's on our YouTube. Interesting. We're gonna wave at everybody. We also, if you guys don't have the income right now or the financing, we do an in-house financing with as low as 65 to 75% down, and we also use a company called Credit Novo. Write that down. So good to us. They have taken people who need second chance credit, who have low credit scores, who just need that break, and they have been excellent to us. So you could use a combination of a down payment with a little Credit Novo. We do that for people all the time. We have at least 30 to up to 60 people a month paying us a little bit a month after they put down their down payment. So it's an excellent, excellent, excellent device. Rhinoplasty Cost. Tip rhinos tend to be around between 5,000 and 6,000, whereas a full rhino tends to be between 8,000 and 10,000. Are they reconstructions? And do I have to take a rib? Do I have to take the back of the ear? Are you missing cartilage? Then we have to talk. But tonight you can get $500 off all of that tonight, just by texting in 210-270-8595. I'll be signing off here in a few minutes. You have still enough time to do it. Please let us know what you need. Go back and look at our old Q&As on my website under Dr. Jeneby Plastic Surgery. Look under Q&A with Dr. J. There's several, lots of information. We are going to get this transcribed. Again, Credit Novo. Go to that website. Get at least $9,000 to $10,000 in credit. You can use in-house financing when you text Stephanie tonight. In-house financing. My buddy Eric Culla is watching. He's my money manager at Northwest Mutual. He is the baddest gorilla in the jungle. If you need a good money manager, Eric Collins watching, I'm not paid to say that. Anyway, I appreciate everybody tonight. It was wonderful seeing you. Stay tuned for next week when we do arms. We start talking about little arm stuff, okay? So as you go, you have the bat wings right below, okay? And so we can lipo that and cut them away. Thank you guys. Peace. We'll be around for virtual consults. I know somebody wanted to do one, so I'll wait a few more minutes, and I'll see you guys soon.